This video is proprietary to THERAKOS LLC and intended to be viewed in its full and current form. THERAKOS LLC does not permit viewers to use, reproduce, distribute, prepare derivative works, or display such video and content in any manner. THERAKOS LLC is not responsible for unauthorized use of this video and its content. The health status of the patient featured in this video reflects her opinions at the time the video was recorded. You're about to hear from a patient about her experience with skin symptoms of cutaneous T-cell lymphoma and treatment with THERAKOS Photopheresis. This patient has been compensated by THERAKOS for their time in sharing their story. However, the views and opinions expressed by them are their own and do not necessarily reflect those of THERAKOS. Please remember that this is just her experience, and that every patient's experience may be unique. This information does not take the place of talking with your healthcare professional. It is recommended that you discuss the therapy and your conditions with your doctor. The following information is about the use of UVidex, methoxylin sterile solution, with the THERAKOS Photopheresis system for the treatment of skin conditions associated with cutaneous T-cell lymphoma, CTCL. In the United States, UVidex methoxylin sterile solution is used with the THERAKOS Photopheresis system for the treatment of skin problems associated with CTCL in patients who have not responded to other types of treatment given by their doctor. Select important safety information. UVidex methoxylin sterile solution should only be used by doctors who have special skills in the diagnosis and treatment of CTCL and who have received special training and have experience in the THERAKOS Photopheresis system. Please carefully review and consider all the important safety information at the end of this video. Please click below for the full prescribing information, including the boxed warning for UVidex. For more information on the THERAKOS Photopheresis system, please speak to your doctor.
I was very anxious. I was scared. I was thinking about how is this going to affect me and my family. I found very few doctors that had this knowledge or expertise with diagnosing as well as treating the CTCL. The information wasn't readily available. However, I had to figure this out, and I was focused on learning more, looking at my options, and understanding what that would look like on a day-to-day basis and my future going forward. I spoke with my healthcare team about CTCL and the skin symptoms that came along with that. I was provided with some good information after getting to the right doctor that was specialized in CTCL, just working through the different options that were available and what was the best fit for me in my particular situation. That was very helpful. And in addition, I did reach out to organizations that support and are advocates for CTCL patients. That was very helpful as well. At the beginning of my treatment for CTCL skin symptoms, I was prescribed a topical steroid cream, and that worked well for a long time. However, the disease progressed somewhat, and the red spots from the skin symptoms became worse, and the itching was terrible, sometimes unbearable. It was very difficult to find the right type of treatment to help with the itching. And eventually, my healthcare team suggested photopheresis therapy to treat the skin symptoms related to CTCL. The nurses explained to me some of the potential side effects, which could include low blood pressure, infection and/or pain at the injection site, and fevers within 6 to 8 hours of the treatment. Patients should speak with their doctors about possible additional side effects with the treatment and precautions to take, like wearing UVA absorbing wraparound sunglasses and avoiding direct and indirect sunlight for 24 hours after the treatment. And remember, this is just my experience. Every patient's experience may be different. I feel I've managed the CTCL well throughout the journey. It has been difficult at times. There's been a lot of highs and lows. I think it's just much easier to go about your daily life with a positive attitude rather than focus on the negative, because there are difficult times. I would encourage other patients with skin symptoms from CTCL to continue to educate yourself. If you don't have a great healthcare team, seek one out that is the right partner for you. That's been my experience. And advocate for yourself. It's very important.
The following information is about the use of Uvadex, methoxylin sterile solution, with the THERAKOS Photopheresis system for the treatment of skin conditions associated with cutaneous T-cell lymphoma, CTCL. It is recommended that you discuss the therapy and your conditions with your doctor. What is Uvadex, methoxylin sterile solution? In the United States, Uvadex, methoxylin sterile solution, is used with the THERAKOS Photopheresis system for the treatment of skin problems associated with CTCL in patients who have not responded to other types of treatment given by their doctor. Important safety information. Uvadex, methoxylin sterile solution, should only be used by doctors who have special skills in the diagnosis and treatment of CTCL, and who have received special training and have experience in the THERAKOS Photopheresis system. Do not use Uvadex if you are allergic to methoxylin, any product similar or related to it, such as Sorolin, or any of the other ingredients in Uvadex. You have a history of a light-sensitive condition or disease. You have had an eye lens removed. Use of Uvadex in this condition can increase the risk of retinal damage. Warnings. You may be at greater risk of sun sensitivity with Uvadex. Tell your doctor if you're taking other medications that cause sensitivity to sunlight, such as anthralin, coal tar or coal tar derivatives, griseofulvin, phenothiazines, nalidixic acid, halogenated salicylanilides, bacteriostatic soaps, sulfonamides, tetracyclines, thiazides, and certain organic staining dyes such as methylene blue, toluidine blue, rose bengal, and methyl orange. If you are pregnant or plan to become pregnant, tell your doctor. Methoxylin can harm your unborn baby. Tell your doctor right away if you become pregnant during your Uvadex treatment. If you're breastfeeding or plan to breastfeed, tell your doctor. It is not known if methoxylin passes into your breast milk. After Uvadex is given, exposure to sunlight and/or ultraviolet radiation may result in premature aging of your skin. Let your doctor know if you currently have skin cancer or if you had skin cancer in the past. If you're given too much Uvadex, you may get serious burns from UVA or sunlight, even through window glass. Avoid exposure to sunlight during the 24 hours after treatment. Exposure to UVA light when Uvadex is used can cause cataract formation if proper eye protection is not used. You must wear UVA light-absorbing wraparound sunglasses for the 24 hours after treatment with Uvadex when you're exposed to direct or indirect sunlight, whether you are outdoors or exposed through a window. If you're being treated for graft versus host disease, GVHD, consult your physician for information regarding blood clots involving the lung and other parts of the body which have been reported in these patients. The use of Uvadex for the treatment of GVHD is not approved by the FDA. Safety of Uvadex in children has not been shown. Side effects of Uvadex. Side effects of Uvadex used with THERAKOS Photopheresis system are mainly related to low blood pressure. For the THERAKOS Photopheresis system procedure, What is the THERAKOS Photopheresis System procedure? The THERAKOS Photopheresis System procedure is a medical procedure in which blood from a patient is collected into a specialized machine that separates the white blood cells from the other blood components. The other blood components are returned to the patient, and white blood cells are then treated with Uvidex, which makes them sensitive to ultraviolet light. The treated white blood cells are exposed to UVA irradiation inside the machine and then returned to the patient. This medical procedure is used to treat skin problems associated with CTCL in patients who have not been responsive to other forms of treatment given by their doctor. Do not undergo the THERAKOS Photopheresis System procedure if you have a condition that makes you unable to tolerate loss of blood volume, you are allergic or hypersensitive to 8-methoxysorolin, methoxylin, or sorolin compounds. Your doctor has diagnosed you with a blood clotting or bleeding problem that can lead to either a blood clot or excessive bleeding. You have had your spleen removed. Warnings for the THERAKOS Photopheresis System procedure. Treatments with THERAKOS Photopheresis System should always be performed where standard medical emergency equipment is available. THERAKOS Photopheresis System procedure should not be performed on the same day as procedures that can cause fluid changes, such as renal dialysis. Side effects of the THERAKOS Photopheresis System procedure. Low blood pressure can occur with the THERAKOS Photopheresis System procedure. You may get an infection and/or feel pain at the site of injection. Fevers of 100 to 102 degrees Fahrenheit, 37.7 to 38.9 degrees Celsius, have been seen in some patients within 6 to 8 hours after treatment. Redness of the skin may also occur with the fever. A decrease in red blood cells can occur if the THERAKOS Photopheresis System procedure is given too frequently. Low levels of red blood cells may cause you to feel tired. These are not all of the possible side effects of the THERAKOS Photopheresis System procedure. Tell your doctor about any side effects that bother you or that do not go away. Call your doctor or pharmacist for medical advice about side effects. You may report side effects to the FDA. Call 1-800-FDA-1088 or visit www.fda.gov/medwatch. You may also report side effects by calling THERAKOS LLC at 1-833-223-4ECP, 1-833-223-4327. Please see the full prescribing information, including the boxed warning for Uvidex, at www.therakos.com.